Hello, my name is Byron Brayton, and I wanted to talk to you about my experience of having kidney cancer. I've had it twice. And so the audience that I think would appreciate this video are people that have been recently diagnosed with kidney cancer and are really concerned about what's coming up in the future. So I'll share my experience with what I've gone through and maybe make it a little easier for you. My journey started when I had a dull pain or a dull ache in my lower left back. And I thought it was a muscle problem. And so after a couple of weeks of that, it wasn't going away, and I would have my wife push on my back to try to find that sore muscle. Well, it wasn't a sore muscle because anywhere she pushed, it just didn't have that feeling of relief. So I went to my doctor, and he took an x-ray and didn't see anything. And he said, well, it must be a muscle issue because he couldn't find anything wrong in the x-ray. And by a very fortunate chance, he showed my x-ray to a radiologist who saw something on my right side that he was quite concerned about. And he said that I need to have a CT scan. So the doctor arranged that I'd have a CT scan. I had to call in to make the appointment for what time I would go in. Well, at the CT scan, the thing that the radiologist saw was nothing. That wasn't a problem. But that's when they discovered I had a really large tumor on my left kidney and that was going to have to come out. But first, they wanted to do also an MRI so they could get a more detailed image of this tumor that was on my kidney. And now this was probably 9 years ago when this happened. So I went into my appointment for my MRI, and I'm filling out the paperwork. And one of the questions was, are you claustrophobic? And I didn't want to admit to being claustrophobic, so I just left that unchecked. Then it was my turn to go into the room where the MRI machine is, and I see this big machine with a very tiny hole that it looked like you could barely get a basketball in. And I realized I was going to have to be sliding into that hole. And I got kind of concerned about that. But I was hoping that I'd go in feet first and it wouldn't be quite so bad. Well, it wasn't that way. They had me lay down on the bed. I was going to go in head first into this long tube. And to make it easier, they have a light at the end of the tunnel, and then they have a fan blowing air in. So you get the feeling you're not just stuck in an endless tube. And they give you headphones to wear. They ask you what radio station you want to listen to. And then they give you this rubber squeeze bulb thing. And the person said, if it gets to the point where you can't take it anymore, squeeze the bulb, and they'll stop and they'll let me out. Okay, that sounds like fun. So I lay down on the bed, and they have you put your hands up over your head, and in you go. And the tube is right in front of my face, and it was very claustrophobic. And I slid all the way in, and they began the process. And an MRI process is a very noisy process, so it's good to have the headphones on. And listening to a radio station is distracting. So I would just close my eyes and put up with it. And there were probably 3 times during the process where I almost squeezed the bulb to end the process, but I knew this had to be done, that I have a large tumor and I want them to see as much information as possible about that. So I just fought through the urge to quit that and to continue on. And after probably 15 minutes, it was done, and my bed slid out of this tunnel. And I would have to say that was a pretty terrifying moment to go through. As a result of the MRI and the CT scan, they were able to get a better look at the tumor. I had a visit with the surgeon, and he said it was probably 95% chance that it was a cancerous tumor. And somehow when he said that, that was the first time I'd ever been told I have cancer. And it really hit me hard. And I had this fight or flight feeling. Like I wanted to get out of the room and just run to get away from the problem. But where am I going to run? The problem is inside. So I just had to sit there and take it all in. And I got lightheaded at one point, and I asked him if I could lay down on the exam table, and so he let me. He said, "Of course." So I laid down, and he put some cold paper towels across my forehead, and which actually helped. And I was able to just think about this. Okay, now I've got cancer. I didn't know I had it when I walked into this room, but now I know I do have it. So that was a big shift in my thinking. And so we talked about this, and the surgery was going to be, it happened to be on a Friday, about 3 days away. This must have been Wednesday when I saw him. And he just talked about the surgery. Now, normally with kidney cancer, to remove the tumor in the kidney, now what they do is make several smaller incisions, and they're able to remove the cancerous tissue that way. However, in my case, since the tumor was so large, tumor was larger than the kidney itself, they had to do it the old-fashioned way. An open radical nephrectomy, I believe is what it was called. So they had to make an incision from just above my navel all the way over to my left side. They're going to make a big opening and then remove it that way. And the surgeon that I had didn't have much experience with that type of surgery. So he hooked up with another surgeon, an older surgeon who had more experience with that type of surgery. So I knew the two of them were going to be there, so I felt I was in pretty good hands. And so Friday morning comes along, I show up at the hospital and get ready, into my gown, get on the bed, and then they wheeled me into the operating room. And the next thing I know, I'm trying to wake up, and I hear a person talking to me, and I asked her, "Is it over?" Because it seemed like it went really quick, and she said, "Yeah, it's over." And it was like a 4-hour surgery, I think. And the rest of that day, I don't remember much of the day. But the next day, Saturday, I think this was the day when they wanted me to get up and start moving, start walking. And what I was shocked at was they just wanted me to walk from my room to the end of the hall, which was maybe 20 feet, because my room was the end room. About 20 feet, and turn around and come back. And that was really difficult, to walk 40 feet. I remember as I was walking, I am just exhausted, and getting back into the room, and I sat down in a chair, and what a relief to make it that far, which is amazing to think that, because before going into the hospital, I rode my bike regularly, and walking 40 feet was a non-issue, but starting then it was an issue. So I think I was in the hospital about 5 days from that, and every day got a little better, and they sent me home, and I was pretty much in bed at home for the next 2 weeks or so. And I had a goal. This surgery took place in the middle of November, and my goal was to be able to drive from Minnesota to Palm Springs, California at the end of December. So I had about 5 weeks to get to the point where I could drive 8 hours a day. And so that was something to look forward to. It was nice to have this goal in mind. And I had some pretty potent painkillers that I could take. And they'll always tell you to stay ahead of the pain. So don't wait till the pain gets real bad and then try to subdue it. Once you feel the pain coming, take the painkillers, and it's just much easier that way. And that's good advice if you're going to put up with that. Now, I had a friend who also had kidney cancer, But his they caught earlier. The tumor was much smaller. So he went through the surgery with the smaller incisions, and he was back at work in 2 weeks. So, like, wow, that was quick. Because for me, even though I achieved my goal of driving to Palm Springs, it took about a year before I felt back to normal. Um, I didn't have a lot of motivation. I didn't have a lot of endurance. I don't know. It was a big traumatic experience, and it took a long time to get back to normal, where I could feel like my old self. And so what they did, they set up scans every 3 months, come in for a scan to make sure that there wasn't cancer somewhere else that was spreading. 3 months, then it would go to every 6 months. And then at the 4-year mark, he said, come back in a year for another scan. So I came back, so that would be the 5th anniversary, scanned, did my final scan, and it looked clean, very clean. So he said I didn't need any more scans, because if it hasn't shown up after 5 years, good chance that it won't come back, which made me a little nervous. I thought, well, what if it does come back and I'm not getting these scans? I'm not going to know. Well, about a year and a half after my final scan, one night I got this tremendous pain just below my sternum, right in the gut there. It felt just like a gallbladder attack. But I knew it couldn't be a gallbladder because 6 months after my big surgery to remove the kidney, I had my gallbladder removed. So I had a period of time there where I was making lots of hospital visits. So I didn't have a gallbladder. So this had to be something else. And it happened at like 2:30 in the morning. It woke me up, and I got out of bed and I'm walking around the house. It was such bad pain that there were times I couldn't even breathe. And this, I was just hoping it would go away. It would kind of subside, then it would come back. And finally, my wife said, okay, we need to get you to an emergency room. And it had subsided by that point. The pain had gone away, but I thought, yeah, we need to get this checked out. And so I went to the emergency room, and they checked my records to see that I had just recently had kidney cancer. They said, you should have a procedure done that we don't do here. We're going to send you to North Memorial Hospital, and they'll do an endoscopy treatment. So I went there. The guy did the treatment or the procedure, and when I woke up from that, he said, your cancer is back. But this time he saw a tumor on my pancreas, but he had taken a biopsy, and it proved positive for being kidney cancer, and it was spreading to different organs. So he contacted my oncologist. I got reacquainted with him, and we did a number of scans. Did another MRI, but this time it wasn't as terrifying. So apparently in the 6.5 years between MRIs, they improved it to the point where it wasn't nearly as bad this time. But I found out I had a tumor not only on my pancreas, but on one of my lungs. I had a small tumor, and my lymph nodes were swollen. So the oncologist gave me a choice. He said, we can either do surgery to remove these cancerous bits and pieces, or we could do immunotherapy. And immunotherapy, between those two choices, I didn't know what it was, but it sounded a lot better than surgery. So, and he agreed. He said, I think you're a good candidate for immunotherapy. And he explained how it would be an infusion. It'd be like getting an IV regularly. It turned out to be every 28 days. So, okay, we agree that's what I'm going to do. And he said, and I highly recommend you have a port placed in your chest. It'll make it much easier to do these infusions. They won't have to do an IV in your arm each time. So I did. I went and made an appointment to have a port placed in my chest. Now, while I was there, waiting for this procedure to happen, laying on this bed, a nurse was in the room with me, and she asked me if I'd ever seen a port, which I hadn't. And so she opened a drawer, she takes out this port and shows it to me, what it looks like. It's like a little steel button with a vinyl top is what it looked like. And that part made sense. It looked pretty much like I thought it would look. But then there's this long tail, little wiggly tube hanging off of it. And she said, now, when they install that, they're going to put it under the skin. They're going to cut an incision and put this under the flap. And then they're going to route under the skin this little tail and take it up to your jugular vein, make an incision in the vein, and drop the tail of that into the vein. And when she said that, I didn't realize that they were going to be doing that. That was the second time. I wanted to get up out of the bed and run away. The fight or flight thing happened again. But I thought about it. I thought, okay, I can't leave. I got to have this done. So I'll just gut it out and let them do it. The anesthesiologist came in and talked about what's going to happen, and he said that he would put me kind of like half asleep, half awake during the procedure. And I told him, since I had just heard about this jugular vein, I said, I wouldn't mind not being awake for the first part of this and missing that. And he said, okay, well, we can do that. And so they wheeled me in, and sure enough, I'm out. And I wake up, kind of groggy, and these people are still working on this. And there's talking, and there's music in the room. It sounded like kind of a fun place to be, actually. But I'm half asleep. And then when it was done, wheeled me back to the room so I could wake up. And in the process, I had 4 different people tell me, now when this heals, they're going to use glue to seal the incision. Don't pick at it. And it was funny because everyone I talked to, they'd answer my question or tell me some information, and they'd always say, and don't pick at it. So apparently it's not good to pick at this healing incision. Fortunately for me, it wasn't a problem. It never was itchy or anything, so I let that heal. This was on a Wednesday afternoon, so they let me go home. I got a ride home. My wife drove home, and I thought I should really make an appointment for my first infusion. So I called the number that I had for the schedulers, and the lady answers, and I said, I need to schedule my first infusion. Could I have this done Friday? Now, this is Wednesday afternoon, and I'm asking to get an infusion Friday. And she laughed when I said that, and I didn't know anything about infusions. I didn't realize that normally they're scheduled, weeks in advance, not 2 days or a day and a half in advance. And she said, well, it would take a miracle to get one done on Friday, but let me check. And so she checks, and she said, there is an opening Friday. And I said, I'll take it. She said, okay, you got it. And so that worked out really well. I started my treatment on 2 drugs. There's Opdivo and Yervoy. So it's a combination of 2. You've probably seen commercials on TV about those 2. And it's just an IV situation. You go to your appointment, and you actually have 2 appointments. The first appointment is accessing your port. So you'll have a nurse come in and clean the area and stick a needle into the port, and then it's all taped down and stuff so it doesn't move, and it leaves a little pigtail. So then when it's time to do the actual IV, they just deal with that and plug it in. It is so slick. It's so much better than trying to poke around in your arm and find a vein. So the first appointment is having it placed, and then they come in and they do blood tests and to make sure that all your levels are where they should be, and they start giving you your infusion. And in my case anyway, it takes about a half hour for the bags to empty. And after the first treatment, everything, I felt fine, no problem. And then we were going every 3 weeks at that point for the first 4 treatments. 3 weeks later, I get my second treatment. I feel great. After the third treatment, feel great. Then my final treatment with the Yervoy and Opdivo, had that on a Wednesday. Well, when I woke up Saturday, I felt lousy. I felt really fatigued, and I had no appetite. And I felt all I wanted to do was just stay in bed. Well, that's when it really kicked me that this was something serious that I've been taking. And so for the next 10 days, all I wanted to do was stay in bed. And one anecdote, my wife was saying, you need to eat something. And she had taken a piece of toast, buttered it, cut it in half, and put a half a piece of toast on a plate in front of me. And I looked at that half piece of toast, and I thought, there is no way I can eat all of that. That's more than I could possibly eat, because I just felt full and food didn't look good. So that's the level I was at. During that 10-day period of time, I had this intense pain in my scalp, and it was like a cap that was on really tight, and it hurt. And if I was going to raise my eyebrows, I couldn't, because it caused a lot of pain in the muscles. Or I remember at one time I sneezed, and man, did that hurt. And so it was this tight area on my scalp, a lot of pain, which this was in June, late June. In September, I was really concerned about this because I wasn't seeing any positive results from my infusions. And I was worrying about, what if this isn't working? And I started losing hair. And I'd take a shower, I'd comb my hair, and I'd end up with a handful of hair in my comb, which that's not one of the side effects of immunotherapy. So I figured this must be stress that's causing me to lose hair. And I realized how much energy it was taking to worry about this. And I got to the point where I thought, I can't expend this much energy worrying. I'm not going to worry about this anymore. Whatever happens to me happens, and I'm not going to worry about it. And so I was still losing hair, so I had a haircut, and I had it cut really short. And my hair a year and a half ago was brown. And so I got the haircut really short, and the barber said, you look like a calico cat, because all of the hair that was growing in or growing out from where my scalp was so sore was now gray. And so I would imagine that pain that I was feeling was the process of my Opdivo and Yervoy combination was attacking the cells that produce pigment. It's got to be, because there was no pigment in that part of my hair. So it looked really bizarre. I had this white hair on top, really dark hair on the sides. And so that's all I can figure was that. Now, another side effect, it's closely related to that, is I also lost the pigment in my skin. So now I'm very pale year-round. Not just I don't look like a Minnesota boy in the winter. In the winter, I look like that year-round. So I'm very pale. So anyway, after the first 4 infusions, I went on just Opdivo, and that was every 28 days. And once I got past that tough time in June, I didn't feel bad anymore. I didn't have any side effects that caused me to feel bad. Got a lot of energy back, went back to bike riding more. And so this continued, but like I said, I wasn't seeing anything positive from these. And my oncologist assured me that this was normal. Actually, the tumors were growing a slight little bit. He could tell by the CT scans that I'd get. Every 3 months I'd get a scan. And finally in my November, I had a scan done, and I went to visit him a couple days later, and he said, the tumor on your lung is gone. And what great news that was, because we'd gone from 3 months earlier, well, It's either the same size or it has grown slightly to it's gone. So I knew at that point that this treatment was working. So that was about 6 months into the treatment when it started. You could tell it was targeting and it was destroying cancer cells. And so then he said it was a 2-year treatment, so I'd be on it for another year and a half. So every 28 days, I would go in for a treatment, get my infusion through my port. And yes, they do stick a needle into the port, but they give you can get a tube of this painkiller that you rub on the skin on top of the port. You just put it on there and then take a little piece of cellophane, some saran wrap, and put it over the top of that before you leave. It's about an hour before they're going to do the treatment. And then it's called lidocaine, and that'll cause that skin to lose feeling. So when they put the needle in, there were times I didn't feel it at all. So it's not something to worry about. And see, the other symptoms that I developed during the final year, in addition to losing all my pigment, was a dry mouth, which is pretty common. And I'm hoping that'll come back. I'm hoping it'll go away, I should say. And then there are just odd aches and pains, little muscle pains that will be there anywhere from a day to 2 weeks, and then they'll go away. Might be in a joint. I had a really sore right knee. It was even hard to get up out of a chair and walk. That was for a couple of weeks. And then I'd go for a walk every day, and the pain went away. And I was so happy that, my knees are pain-free. Well, then it hit the left knee. Now my left knee was sore for a while. And it wasn't in the joint itself. It seemed like it was in the tendons and ligaments around the joint. So things like that will happen, little aches and pains, but they go away. The vision, it felt like there was a fog on one side, and I had my eyes checked. Everything physically looked normal, and that fog feeling that I had, that went away. So a lot of odd things can happen, but the important thing is that it targets and kills the cancer cells. So I had my final treatment 6 weeks ago, almost 2 months ago, and I'm doing fine. I go in a month from now. I'll have another scan, a CT scan. I'll visit my oncologist, and that's my first post-treatment scan that I'll have. So I'm assuming we'll just repeat it every 3 months and then go to every 6 months and then a year later. But I'm feeling well, so if you've just been diagnosed with kidney cancer, you can be confident they have a lot of treatments now besides just surgery. My oncologist had said, if I had had this situation 10 years earlier, the only option would have been surgery. So I'm glad I got it when I did.